Ladies and gentlemen, please welcome Kent Emerson, President of the Empire Club of Canada, to the podium.
Good afternoon. Good afternoon, ladies and gentlemen. From the Arcadian Court in downtown Toronto, welcome to the Empire Club of Canada. For those of you just joining us through either our webcast or podcast, welcome to the meeting. Today we present the Honourable Ginette Petitpas Taylor, Canada's Minister of Health discussing preparing our healthcare system for an aging Canada. This is the second Empire Club healthcare event that we've had this season. We had a fantastic event earlier in the year about national pharmacare, looking at the pros and cons of that. And at that event, we had a pollster called Nick Nanos explain how important healthcare is to Canadians. With the federal election just a few short months away, it is important to take note that healthcare still takes priority over many prominent issues in the minds of Canadians. And yes, there's issues that you hear more of, such as climate change that capture the attention of the media. But just because it's in the news does not mean that that's what Canadians are driven by. And just a few weeks ago, to underscore this, the Ipsos Reid poll said that 50% of Canadians rank healthcare in their top 3 issues that should be focused on, well ahead of other issues. Climate change got 33%, taxes got 33%, poverty got 23%, education 22%, and immigration got 20%. So, and 1 in 5 Canadians rank healthcare as their #1 priority. And because healthcare is that important to Canadians, we made sure that we got the federal minister here at the Empire Club of Canada prior to the next general election. One of the greatest healthcare priorities facing our country is the need to respond to the changing social norms regarding seniors' expectation to live and age independently in their own homes. We know that our seniors play an invaluable role in their own families and contribute significantly to the social fabric of their communities. Canada's growing active senior population is therefore a testament to a progressive healthcare system and our success as a society. While seniors of the future are predicted to be among the healthiest in history, it is also known that the likelihood of developing chronic conditions such as dementia, diabetes, lung and heart disease increases with age and can seriously compromise the prospect of future independence. Our hospitals play an important role in supporting people with acute issues, but we know that a strong home care system will be the longer-term solution to broader healthcare reform. Thank you, Minister, for coming to discuss how healthcare must retool to respond to the needs of our growing senior population so they can remain healthy and happy in the home and community setting. So before we get started, I'm going to introduce our speaker today. There's going to be a Q&A just after the speech, and so all of you can think of your questions. We will come to you with a microphone. Today's speaker was elected in October 2015 as a Member of Parliament in the riding of Moncton, Riverview, Dieppe. She serves as the Chair and Subcommittee on Private Members' Business of the Standing Committee on Procedures in House Affairs and is a member of the Subcommittee on Private Members' Business of the Standing Committee on She has also served as the Deputy Government Whip from December 2015 to January 2017. In January 2017, she was named the Parliamentary Secretary to the Minister of Finance. She has spent her entire life advocating for a fair and just society for all. She was the former chair of the New Brunswick Advisory Council on the Status of Women and a member of the Coalition for Pay Equity. She has volunteered with several community organizations, both provincially and locally, including the Coalition Against Abuse in Relationships and the Canadian Mental Health Association's Suicide Prevention Committee in Moncton. She has served on the City of Moncton's Public Safety Advisory Committee, which was commissioned by Moncton City Council in 1996 to proactively influence the community through crime prevention and promotion and to help council respond to problematic issues as they arrive. She grew up in Dieppe, New Brunswick, and graduated from the University of Moncton with a bachelor's degree in social work. Please welcome Canada's Minister of Health, the Honourable Ginette Petitpas Taylor. Thank you.
Well, good afternoon, everyone. Bonjour à tous. It's really an honor and a privilege for me to be here with all of you today. And before I begin, I would also like to acknowledge that the land on which we gather is the traditional territory of the Mississaugas of the New Credit. Thank you for the warm introduction, and I also want to thank the Empire Club for inviting me to speak today about one of the greatest challenges and opportunities that our country faces. And finally, I would like to also thank each and every one of you for joining me here today. Perhaps I'm going to have to start perhaps with an apology. Coming from the East Coast, we're always talking about the weather. And I was hoping that I was going to see the sun here today, but I see that I brought the rain along with me. But all kidding aside, I've had a wonderful morning so far. Started off in Davenport and had a round table on the issue of healthcare. And then from there had an announcement on public awareness and prevention regarding cannabis. So we've had some good announcements, and today I'm very pleased this afternoon to be here with all of you. So in 2017, Canada marked a major milestone. It was a milestone that says a lot about us as Canadians, who we were, who we are, and who we will be. But I'm not talking about Canada 150. I'm not talking about the 100th anniversary of the Battle of Vimy Ridge, nor the Tragically Hip's last concert, or even the Leafs finally making it to the playoffs. In 2017, our census revealed that for the first time ever in Canada's history, Canada has more seniors than children. In the 2 years since then, this gap has only widened, and seniors are now the fastest growing group of people within our country. As a Maritimer, we feel this more acutely out east, but it's having an impact right across the country. And I know every province and territory, when I visit and meet with health ministers, I hear this day in and day out. On a side note, I really have to say that I hate it when folks talk about aging and oftentimes refer to it as a tsunami. A tsunami arrives only with a few minutes warning. Aging is a challenge that we know that has been coming for quite some time. And I know this comes as little surprise to many of you in this room. From the kitchen table to the boardroom table, no facet of Canadian society will be unaffected. As I know that many of you are leading efforts to prepare for this, and your government is too. We're acting now to ensure that Canada is ready so that all of our seniors can live life to the fullest. And that's why that we've created a new role in Cabinet specifically for them, Canada's Minister for Seniors. We've also increased GIS payments, bolstered the Canada Pension Plan, and lowered the eligibility age from old age security back from 67 to 65, and ensuring stability for nearly 1 million older Canadians. These bold steps, along with many others, will make a difference in the lives of so many Canadian seniors. Yet, there's something that will be affected by our aging population more than anything else, and that's our healthcare system. Unsurprisingly, the older people get, the more they need. Unsurprisingly, the older people get, the more need that they have with respect to healthcare. Confronted by the demographic realities that I just mentioned, there is no question our healthcare system will come under strain. And that's why that we're acting now. We know that there's no one-size-fits-all solution. Rather, we must prepare for an aging Canada by fundamentally shifting the orientation of our healthcare system from hospital to home care. And let's put this into perspective. This month actually marks the 100th anniversary of Canada's first federal health department, so this is the perfect moment for a brief glance back. Our system has gone through three distinct eras, and we're about to enter the fourth. The first era, government did little. For the first 50 years of Confederation, health was actually handled by the Department of Agriculture. Yes, I said agriculture. The second era began in the 20th century when the climate of social change finally spurred government to set up a dedicated health department in 1919. Over the next 50 years, the federal government played an ever-expanding role in healthcare, gradually assuming greater responsibilities until the advent of universal public health care, first in Saskatchewan and later nationwide. The passage of the Medical Care Act in 1966, followed by the Canada Health Act in 1984, marked the dawn of the third era in which government became a central player in healthcare. The past 50 years have seen government make major investments in acute care, like hospitals and other frontline services. As our population ages, we are entering a new era, a fourth era. Since taking office in 2015, our government has begun transforming our healthcare system from one focused on acute care for young population to one serving the long-term needs of older Canadians. Now, I know full well that government doesn't have all the answers. And that said, I think that we can certainly ask the right questions. And that's why that we've launched last year our Healthy Seniors Pilot Project, a $75 million initiative based out of New Brunswick to help us better understand the impact of aging and how that we can support our seniors. The lessons learned will be implemented nationwide, and I'm truly excited to see these results. Our work to transform the healthcare system begins with major commitments to home care. It's no surprise that Canadians want to stay home for as long as they can, be it comfort, familiarity, or dignity, to say nothing of the impact on physical and mental health. There are so many reasons why we want to age at home. Yet, with government focused on acute care over the past 50 years, there was little attention and even less investment in home care. And today, we see the results. We've changed that. In Budget 2017, our government made the largest investment in home care in Canadian history, an unprecedented $6 billion. This represents a serious commitment towards a healthcare system that cares for Canadians right where they are at. It's being spent in 4 areas. Number 1, scaling up home care models that are proven to work and connecting them more closely with the healthcare system. Increasing support for caregivers and improving home care infrastructure like digital connectivity and giving more people access to palliative care. Over the past 2 years, we have reached agreements with every province and territory detailing how this money will be spent, ensuring that it goes where it will make the greatest difference in the lives of Canadians. But $6 billion is a big number. How does that money actually help Canadians? It's a personal support worker, perhaps, who used to come once a week, now caring for a senior every day. It's the patient's health information being collected at home and directly sent to be monitored by their doctor, meaning less time in hospitals. It's those nearing the end of their lives spending their final days in comfort with those they love. Home care is also the smart thing to do for our healthcare system. Beyond seniors, it benefits many Canadians with disabilities and also those living with chronic disease. It reduces the burden on hospitals and nursing homes, freeing up space for those who need it most. And it keeps Canadians healthier, both physically and mentally. Of course, seniors aren't just the biggest users of our healthcare system, they also need the most prescription drugs. Some of you might have heard that we're doing something about that these past few days. Since coming into office, we've taken several bold, concrete steps to make medication more affordable. We've joined the Pan-Canadian Pharmaceutical Alliance, which allows us to bulk purchase drugs. We've proposed significant changes to the rules that govern drug pricing. And we've announced the creation of the Canadian Drug Agency and committed $1 billion towards the high cost for drugs for rare diseases. And finally, we're making progress towards the National Pharmacare Program. We recently received our Pharmacare Council's final report, and we're excited to move forward. We will not rest until every Canadian, and especially our seniors, get the medications that they need. We can't talk about aging unless we talk about dementia as well. A Canadian is diagnosed with dementia every 7 minutes in this country. We have over 400,000 seniors already living with dementia in Canada. And I'm pretty sure that everyone in this room knows someone who's affected by dementia, either a family member or a loved one. And I also know that dementia doesn't have to be scary, but it is. What could be more frightening or terrifying than losing our own memory or our mind? Yet, it doesn't have to be that way. Folks with dementia can live well at the heart of their communities, and our government is determined to make sure that that happens. To advance our understanding of dementia, we have invested nearly $200 million in research over the past 5 years and supported a national research network. To ensure our work is informed by those who know it best, we've established a ministerial advisory board on dementia and hosted the first ever National Dementia Conference in Ottawa last year. And to unite all of our efforts, just last week, we launched Canada's first ever National Dementia Strategy. And I'm proud to say that our ministerial advisory board is comprised of many wonderful Canadians from coast to coast to coast, researchers, experts in the field. But one thing that was very important to me was to make sure that we have people with lived experience and caregivers that were there. So we have several of our advisory council members that are living with dementia and those that are also caring for them. So they're the ones that informed us and told us what needed to be in that strategy. And that's why that I'm very, very proud of the work that has been done. The strategy sets out 3 bold objectives. Number 1, preventing dementia, advancing therapies, and finding a cure, and making a positive difference in the lives of Canadians with dementia and those who care for them. But let's be honest, over the years, governments, and I mean governments of all stripes, have put in place an array of national strategies. So you may ask yourself, what makes this one different? Well, it's because that we're putting our money where our mouth is. And in Budget 2019, we've invested $50 million to help implement the strategy. And that is the beginning. While we work to ensure that Canadians are ready to face challenges of aging, we must also ensure that Canada itself is ready. If we're serious about seniors living at home longer, then we must make sure that our communities are age-friendly, set up in a way that helps seniors live safe, healthy, and engaged lives. This work is well underway in over 1,200 communities across our country. Big cities like right here in Toronto and Calgary have age-friendly strategies which guide these efforts. And meanwhile, in small cities or towns like Saanich, British Columbia, they have incorporated an age-friendly lens into all municipal departments. They plan on building 200 kilometers of new sidewalks, complete with better ramps and crossings, so that seniors can stay active and healthy. And as I come to the end of my remarks today, I want to touch upon the elements of healthcare that generally comes last, and that would be palliative care. Palliative care is both one of the most essential and most difficult parts of our healthcare system, and it's literally a matter of life and death. I think we can all agree that everyone, and I mean everyone, should live out their final days in the comfort of their home, in dignity, in the setting of their choice, and surrounded by their friends and loved ones. Yet the reality is that not everyone in this country has access to palliative care. That's why we've introduced our framework on palliative care in Canada last September. The point of the framework is to get everyone on the same page, giving government, stakeholders, caregivers, and others a common reference point that helps us share ideas and best practices. Let's not kid ourselves here. Palliative care can be scary. There are few things harder than confronting one's own mortality. But we must encourage all Canadians to do the same. Whenever I talk about seniors' care, I think of my dear friend, Dr. Tedros, the Director General of the World Health Organization. And he likes to say, when it comes to caring for our elderly, we all have a vested interest, because one day we'll be the ones who need it. And that's why we're taking action today. We all know that Canadians are proud of their healthcare system. It's almost a cliche at this point, as anyone who's spent time in the United States. This is actually something that I've been reminded while watching the Raptors game during the NBA Finals, when Cohen O'Brien tweeted, "Win or lose, at least the Toronto Raptors know they have access to health care." Oh, and one more thing I should add. I see lots of businesses here in Toronto are offering Kawhi Leonard free food or a free apartment or even a lifetime supply of ice cream that I've heard. So I want to send him the same challenge. If he stays here, we'll provide him with free health care. But back to the matter at hand. Just because we have a sturdy vessel doesn't mean that we don't face rough seas. There are storm clouds on the horizon, not a tsunami, but a squall nonetheless. So can you tell I'm a maritimer here? That's why we're battening down the hatches, strengthening the hull, and trimming the sails so that our system can weather the storm and emerge stronger than ever. Once again, I want to take this opportunity for all of you for being here today. We all have a role to play in making sure that we prepare our health care for the needs of the 21st century. Merci beaucoup tout le monde.
So we're going to take a few questions for the minister. And we have a question over there. If you could, the mic's going to come to you. If you could say your name and then in your organization, that'd be great. And I know you.
Durham Wong Rieger, the Canadian Organization for Rare Disorders, and really want to thank the minister. I will say, I'm going to ask you a question or put a question to you, but not to take away from, I think, the amazing things that you as a minister have brought, and certainly what this government has brought. And I think everything you said today really are things that we can be very proud of and truly applaud. So first of all, I just want to thank you very much for all you've done. I've never known personally anybody who is such a personal, compassionate, and supportive of the patient community, so thank you. But you're mentioning Dr. Tedros drives me to really ask. I just met Dr. Tedros for the first time in May, and he was with us on behalf of Rare Diseases and Rare Disease International. And he has said before and made the commitment that no country can be said to actually be serving its citizens unless it actually serves those that are the most disadvantaged, and that includes those with rare diseases. And so we're thrilled with the fact that there is, in fact, a drug program for rare diseases being supported. But we're really curious as to why, in 2015, we presented a strategy for rare diseases to the Parliament. You were there and you spoke to it. And we recognize that you can't actually do drugs well unless you actually have an overall strategy for it. So we're really somewhat hopeful and somewhat puzzled why we have not actually implemented a strategy around that with rare diseases. And I'll just add very quickly, is again, we're truly grateful and excited about having the funding for drugs for rare diseases, but we are also very concerned that if we do not take some real measures in terms of assuring that while we're trying to lower drug prices, we don't do it in such a way that we drive out innovative therapies, we won't have any need for having a drug plan because we won't have these therapies. So thank you very much.
Thank you very much for your question and for your comments. And once again, when it comes to the area of rare diseases, we certainly know that it's an area that it's been long overdue that we pay special attention to it. And yes, we've received the recommendations, and I'm looking forward to moving forward with putting together a strategy to specifically deal with the area of rare diseases. In Budget 2019, we've certainly received some funding in 2 areas when it comes to putting together perhaps with a national pharmacare program. But also from there as well was a significant investment when it comes to rare diseases. The Canadian Drug Agency is going to have a mandate of, number one, putting together a formulary to make sure that we can address what is going to be covered for a national pharmacare program. But also, we are going to have to make sure that we work with provinces and territories to make sure that we have a strategy in place to specifically deal with rare diseases. I know just 2 weeks ago I was in the riding of Fundy Royal, and I did a round table on the topic of pharmacare. But the round table really ended up being a topic on families that have loved ones that have children that have been diagnosed with a rare disease. And it is heart-wrenching to hear what families have to go through. So we want to make sure that we get this right, and that is why that I'm looking forward with, and hopefully we'll have a next mandate in order to do this work, because all Canadians should have access, to the medication that they need, and those also, from the rare disease community, you can't be, overlooked. You have to be an important part of that conversation, and I look forward to continuing this work as we move forward. So thank you.
We do have a question at the back.
Hello, Minister. My name is Laura Tamblin-Watts. I'm with the Canadian Association of Retired Persons. Thank you for your comments today on seniors in particular. I follow with great pleasure your work on social media, and particularly the T-shirts that you've been wearing saying vaccines cause adults.
It's kind of catchy, isn't it?
And Minister, we cheer when you wear those shirts, and we cheer with the work that you've done providing leadership around vaccines. But it's shocking to know that only about 3% of Canada's seniors, who you spoke so eloquently about, have appropriate adult vaccinations. We know that you've been tackling the issue of pharmacare right on. I'm curious if you could speak a little bit to how we could tackle better the critical need for adult vaccinations.
Yeah. Well, thank you so much for your question. And when you talk about my T-shirt, Dr. Gigi Osler, actually, is the president of the Canadian Medical Association, came to see me, and she provided me with a gift, and she wanted to know if I could accept it. And the first thing she said, it's under $25, Minister, so don't worry. But it was this great T-shirt that it puts exactly that: vaccines cause adults. So we took a picture together, and we put it on social media. And a few weeks ago, anyways, I'll get into that afterwards. So I put it on social media. But to my shock, we had over 14,000 comments on this post alone. And I can tell you, I'm a politician, I get an awful lot of comments on social media, but nothing like vaccines cause adults. I just could not believe it. So it's certainly, we know that it's a discussion that's alive and well. I've got to fast forward, and actually 3 weeks ago I was at a cabinet meeting, not that we're supposed to discuss what happens in cabinet, but I just mentioned this conversation to the Prime Minister about all of these comments that I had, and he says, well, I want one of those T-shirts. So I got him a T-shirt, and we took a picture as well, and it was the same response. But again, we have to recognize there's an awful lot of anti-vaxxers that are out there, a lot of bots, and probably people that don't even exist. But it's certainly, we know that we have to do more when it comes to increasing the vaccination rates in this country for seniors and Canadians. And that's why, as the Public Health Agency of Canada, and within the past few years in our budgets, we've received some money in order to increase our vaccination rates. And I think, to your point, we really have to have a targeted lens as to how can we increase our vaccination rates when it comes to seniors as well. And that's an ongoing conversation that we must have and that we need to have, because if we want to increase our vaccination rates, a one-size-fits-all is not going to be helpful. And we also recognize that data collection and making sure that when people, live in one province but move to another province, that we can keep track of these records. Because I know when I speak to my public health officials, I was asking her, what can we do to maximize, the work that is being done here? So there's a lot of work with respect to that, with respect to tracking and with respect to having a specific lens on how to make sure that specific populations will be able to get their vaccine rates, increased. Again, if we look at Indigenous communities as well, we again have to make sure that we have a specific lens to make sure that we can get them where they're at. So that's work that is underway, but for myself as your health minister, my goal is to really make sure that we can absolutely increase those rates, because there's diseases that were a thing of the past and we're seeing now they're emerging again. So we certainly have to do all that we can in order to promote, this best public health tool that we have at our disposal, which is vaccines. Thank you.
Any more questions? One last question over on the left.
Good afternoon, Minister. Thank you so much for your talk today. My name is Nancy Polsinelli, and I represent the region of Peel. And we're very interested in your dementia strategy. We have 5 long-term care homes, and our seniors population is well over 80% with residents with moderate to advanced stage dementia. We have recently adopted the butterfly model of care. Not certain if you've heard about it, but it really looks at the emotional care and well-being of our seniors. Certainly with dementia, we understand that they are feeling beings and not thinking beings. So along with physical care and clinical care, there is a lot of emphasis put on the emotional well-being of our seniors. I'd really love the opportunity to see how that care model can be integrated into the senior strategy, because what we're finding is not only is there a lot of interest across Ontario, certainly in Alberta, but there is a need to help our seniors, those that are suffering with dementia, to help them a little differently than, and I apologize to some, the medication route. And certainly when we look at our incidence of resident-to-resident behaviors, when we look at staff to resident, or resident to staff, I should say, there is an opportunity here to really build on the great work of the senior strategy. So I'd love the opportunity to not only talk to you about it, but maybe have you join us at one of our homes to see it.
Thank you so much for that intervention, and I absolutely agree with you. I think there's a role for the medical model, but there's also a role for differing models as well. I share openly that my 94-year-old mother lives with dementia, so I can tell you putting together this national dementia strategy as your health minister was a priority, but it was also a personal priority of mine. I can remember very well when my mom, when we discovered, if you will, or I had doubts that perhaps this was happening. 9 years ago, I was going to my mom's place for supper one evening, and I had called her just an hour before that I was going to see what she wanted. Swiss Chalet or St. Hubert's was the 2 restaurants of choice that was her preference. And she had given me her order, and when I got home when I got home that evening with her, she looked at me and she says, "What are you doing here?" And my dad had kind of given me a few hints that he thought Mom was different. And I was in denial, I'll be very, very frank. So fast forward, we've provided much support for her. She stayed home for a period of time, but now she's in a special care home. And I have made it a point when I'm at the special care home to make sure that if there's any changes in her medication at all, I want to be made aware of it. And I can tell you the response that I got from the nursing home was, "Well, you can't possibly want us to call you every time that there's a change in the medication." And I was like, "Yes, I want to know exactly what's being done." So you're absolutely right. There's different models, and but we can integrate those types of models. And at the end of the day, I want to make sure that my mom and all seniors have the best care, the best quality of life that they have. Dementia doesn't have to be as scary as it is now, but we certainly have to work together in order to put in place, a model that will meet their needs. So I would be more than happy to have that conversation with you down the road to be able to share some thoughts and ideas on that. So thank you very much.
Ladies and gentlemen, I'd like to call in Noble Chumar to give the appreciation remarks to the past president of the Empire Club.
Thank you, Minister. Thank you for your great remarks. You have a huge responsibility as a minister responsible for something a lot of us care so deeply about. And a society that takes care of our elderly is the kind of Canada that we want to live in. So good luck. And thank you for your remarks, and thank you for spending time with us here at the Empire Club of Canada.
Thank you so much.
Thank you so much.
Now we can stay on the stage for 1 minute, Noble. I want to present you with something. As you might know, a club as old as the Empire Club, 1903, we capture every remark, the good and the bad, from 1903. And we've spent the last 6 or 7 years, and we have all our events on video. And as a past president of the Empire Club, for your year, which is the year of 2013-2014, we've just printed your Red Book. We call it the Red Book. And as you can see, it's a book that has every speech that happened during that year. And I want to present it to you, Noble, for the work you did. Congratulations on your work. Thank you. Ladies and gentlemen, this is the 39th and final event since September of this season, and I want to thank everyone who supported us through the year very much, and I want to wish you all a great summer. We'll be back in September with our new president, Michael Van Solen of Navigator, who will begin in September as the new president. Thank you very much.